since I was in my late 30s, and so I've dealt with the swollen prostate most of my life. So I've had urination problems. I've had to use disteroid to make that flow better, and I've had constant symptoms of getting up at night and starting and stopping. So it was just a normal need to do something about it. I think everything, to be truthful, because you know, you're dealing with the way we, you know, are in life. So we're worried about more than anything losing function. You know, I don't want to lose sexual function. I didn't want to lose urinary function. So, you know, I wanted the safest thing that I thought that I could possibly do, and this just seemed like the best that I've seen, and being able to deal with that for not having a lot of problems afterwards.
Okay. And how long ago did you have the procedure done?
Literally 4 weeks today.
Okay. And then after the procedure, how long do you think it took for you to notice changes in your urination?
There was 4 days of having a catheter. So after the catheter was out, within a week, my flow was better. I was just literally having no real problems at all. My flow got extremely good in comparison to what was normal for me.
Did you notice some of those side effects that you were worried about as far as, I guess, sexual function or losing control of your urination?
No, in fact, it's been just the opposite. I get erections. I have no problems whatsoever with urination, much better than it's been in years and years and years for me. In fact, I can't even remember back to a time when it was really what I consider to be normal. I'm having trouble understanding what is normal that I'm comparing it to. It's been so long since I've had normal flow. I'm still getting up at night, but I'm drinking a lot of water, probably more than I even need to. Oh yeah, I would do it again in a minute. The outcome has been so good that probably the little problems I'm having now would, I just don't know how to say that. I don't know how to get it out well enough, but no, definitively I would do it again.
Okay, great. I think when you mentioned the little problems you're having, we were talking earlier about you're having some spotting here and there. Can you talk about that briefly?
Mainly it's when I start my urination or end it. I have a little bit of blood that comes in then at that time, which somewhat looks like food coloring once that blood hits the urine. The urine is generally very clear, and then a little bit more blood from that after 4 weeks, but I had a very enlarged prostate, and so I'm not terribly surprised with that, but that's the only symptoms that I have. And other than that, my urination and everything else is extremely good. So I have no pain, no other restrictions, my bladder's emptying well. So for me, the outcome has been nothing but extremely positive.